For Hillary Clinton, it is healthcare reform round 2. Her first attempt to overhaul the nation's healthcare system fell apart. Well, now, as a Democratic presidential candidate, she has unveiled a new plan trying to solve a difficult and growing problem. Bill Plant reports.
The U.S. is the only Western industrial nation without universal health insurance. How to do it always gets mired down in politics.
In the case of the Democrats, generally, what you're talking about is a greater role for the federal government. With the Republicans, generally speaking, you're talking about much greater reliance on private markets.
47 million Americans have no health insurance, and that number increased last year. It's no surprise that politicians are concerned about lack of insurance. A new CBS News poll shows that 3/4 of Americans think it's a very serious problem. And it's expensive. Healthcare cost $2 trillion, that's trillion with a T, dollars in 2005. And it's headed to $3 trillion in 2009. An overwhelming 81% of the people in our survey are dissatisfied with healthcare costs. Canada, Britain, and most of Europe have government-sponsored health programs covering everyone. But in this country, that's been politically impossible. Hillary Clinton's failed 1994 health plan wasn't government-run, but would have required tight government regulation. This time around, candidate Clinton says she's learned some lessons. She offered what she says is a simpler plan, requiring everyone to have health insurance with tax credits for people and small businesses who can't afford it.
Now, I know my Republican opponents will try to equate health care for all Americans with government-run health care. Well, don't let them fool us again. This is not government-run.
Republicans will say the Clinton plan does let government take too large a role. But it's the other Democrats, most of whom have already advanced their own plans, who will be Clinton's first and harshest critics. Bill Plant, CBS News, the White House.